type of individual that that has discouraged me is the one that says, well, you're trying to hypnotize me, aren't you? And I made no suggestion of hypnosis at all. In fact, I've had to modify the technique a little bit, and I think it has worked much better for me. I tell them that it's a demonstration of how strong their willpower is, or how well they concentrate their attention, or something like that. And as I say, I've had to modify the technique so that I am more successful with it. I'm still not as satisfied, not very satisfied, but I think I have a very good nucleus from which to grow.
Dr. Burpo, you wanted to say...
Well, now I've got three quick things I want to say. One on that resistant type patient. If I feel that there's going to be any resistance at all, I have them listen to the record without bringing up any subject about relaxation at all. I just want to have a record here, and I think if they go along with it, that they'll find that they'll feel much better. And they listen to that record with usually my conversation down and starts for them. And then when they come back and I start talking to them and I ask them how they did with it, and they say, well, I'd like to just check you out myself and see how you did with it. Well, they're used to the idea of what's going on, and I find that gets around quite a few just in that way. Secondly, on this matter of the children, I don't work with children ordinarily, but I had one experience this last week I thought was fairly shows the value of hypnosis as far as children are concerned. One of the mothers who was over here for the OB class was in the hospital with her daughter, who I think was about 7 or 8, and they were sitting at the X-ray, and I said, my goodness, what happened to you? She said, well, she fell, and she broke her arm, and so I went in and looked at the X-ray, and sure enough, it was broken. And about that time, the orthopedic man got there, and he's very interested in taking this towards the next time it's off, incidentally. The one I told you, I'm showing a little bit about it, and so we just, with this little girl, she was crying quite a bit, and obviously quite a bit of pain, so I just had her close her eyes and went through the children's technique and gave her the suggestion that she got rid of her pain immediately, and gave her the suggestion that anytime she had any pain from now on, all she had to do was close her eyes and cross her fingers, and that pain would go away. So I saw her mother on the, I guess I was there maybe 5 minutes altogether. And I saw the orthopedic man about a week later, and he said, well, as far as he knew, she was doing beautifully. He was really impressed with how well this child had progressed. I talked to the mother, and she said after she took the child home, that didn't even take an aspirin. So with fractured humerus and not even an aspirin, I think that's how I got a lot of benefit from the hypnosis. Third thing is something for your consideration as you're going around the rest of the country. One of my problems in sterility patients, as I mentioned before, was in girls who don't ovulate. And as one of the doctors said here a minute ago, one swallow doesn't make the summer, and I'm very well aware of that. But I have 3 girls now who I've given suggestions for ovulation, who I have been following for over a year, and who ovulate either infrequently or not at all. And 2 of them ovulated over the weekend that I assigned to them. I saw them one Saturday, suggested they ovulate over the following weekend, and then I checked their cervical mucus 2 weeks after that, and they had ovulated. The third one hadn't. I have a 4th one that I just gave the suggestions to this past Friday, so I don't know the results. I say that's only 2 girls who have ovulated one time. Possibly that's all coincidental. But within the next year, I think I'll know enough to know whether it's coincidental or whether it actually is due to suggestion. But at least I have 2 girls who haven't been ovulating, who ovulated at the time that I had assigned to. So if anybody's interested in it, they can go on from there.
Incidentally, you may be interested to know this, Dr. Burpo. The first time that I've ever had a report on the non-taking of an amenorrhea suggestion.
No, this is...
No, I know that. I know that. First report I've had of a failure on an amenorrhea suggestion was this time through the classes. I came across one of them, a 19-year-old girl who'd been married when she was 16. This happened in Oklahoma City, by the way. And I haven't had a chance to do any hypnoanalysis, and I just wonder if the doctor had made a mistake in the way he gave his suggestions, because I'm so used to the suggestion taking, I couldn't find a thing that would keep her from taking such a suggestion that is, I couldn't find anything in a 15-minute interview that I had with a girl. But I want you to know, I did come across one finally, after 10 years. And I'm very anxious to find out whether, after my giving of the suggestion, whether or not it occurs or not. I won't be able to report it to you, but will be, I hope, in the future to be able to report it to you. But isn't that odd, after 10 years, to find one like that? Yes, Doctor?
I had one case like that. She lost her baby, and she had amenorrhea since. So I gave her this 3-day test with progesterone tablets, and then I told her that she would menstruate afterwards, that it was specific, and nothing happened. She called me up. Nothing happened. So over the phone, I said, well, sometimes you have to allow 3 additional days. And she then called me up that she had menstruated.
Yeah, well, I generally give
I think the second suggestion was over the phone.
Yeah.
It was a suggestion that helped.
Yeah. I generally give them 5 full days. I'll never say 3 days or anything like that. I think that you've got to give 5 days to allow the body to build up.
Well, they've got a 3-day pregnancy test with pills. Do estrone.
All right. Well, now let's get Dr. Berber. Did you finish the things that you wanted to cover?
Yeah,
Because I think that's very important what you told about the ovulation.
well, I think that I read something recently about this Sterility and Infertility Congress had met, and they were talking about some various things that they had done with hypnosis, but no one reported anything on ovulation. And to me, that's one of the hardest things to get. If you have a girl who isn't ovulating, well, and wants to have children, you're really up a tree. And if you could bring about ovulation by suggestion, I think you could really make a...
But you're working in line with nature, so I see no reason why the suggestion shouldn't be taken. Dr. Waxman, you said you had some questions to ask, and we generally take time before we do our closing demonstration to take the time out now to get every doctor's question so that we can see the things that they would like to review today. So will you give me those questions at this time?
Well, it was mainly the things that I brought up when you asked us to grade ourselves. That and how to overcome fear is another thing that I'm not too well posted on, because many of the patients, well, 90% of the patients who come into the dental office, who come into my office anyway for the first time, are fearful.
Yeah, been conditioned in prior episodes, yeah.
And to relieve them of that fear is something that I don't know too well how to do. And then
much easier in hypnosis, doctor.
Now, I've had some people also who I have had down in the coma, and then they show all the signs of the coma. But when I begin to work, they come out of it. And I feel that that is fear, and
Sure
I'd like to know how to overcome that.
Just say no, stay the way you are, and you won't feel a thing. You let fear bring you up out of it, and you're going to feel things, so stay the way you are. It's as simple as that, doctor. You merely make a statement, a fact. I feel that your greatest weapon, your greatest help in hypnosis is one thing, truth. And when I will say to a patient down in the coma, now if you stay like that, you won't feel a thing. Just stay the way you are, and nothing's going to bother. And then I won't let fear. Now, if you begin to feel fears or things, begin to worry about things, you can't stay relaxed like you are. So don't you let any fears get in there. I'll say it to them right while they're in the coma, and you'll find that will help a lot. Were there any other questions that you had?
I believe.
All right, anybody got any questions now? Yes, Doctor.
Suppose you've got this post-hypnotic suggestion or post-sleep suggestion, then I'm wasting on that. The numbers isn't quite numb enough. How can you compound it? Is there any way you can compound without putting the patient back again in the sleep?
Just put it back in the sleep.
Just put it back in sleep?
Yeah.
There's nothing you can say to it.
Yeah. Hey, Doc.
You don't have to do that. You can compound just like you compound any other anesthesia. I'm sure of that.
You've done it.
Yeah, I've had him get moderate anesthesia coming out of sleep, and then just crossing the fingers, opening and closing the eyes, any suggestion you want to give, and it'll compound.
It does, huh? Okay. Well, that's an interesting thing, because I didn't even know that. See, I don't get a chance to work with these things in the hospitals and so on. I can only do it in the classroom and show you how well it works. But you fellows get a chance to do it where you actually have the pain to work with. And I don't have the actual pain to work with. So that's news to me. I knew you could compound it, because God knows I have compounded it plenty. But I didn't know that you could compound it that way, the same way you do in ordinary somnambulism then.
Yeah.
And without saying a word, it compounds.
Well, I tell them, cross your fingers and then cross them, it'll be 5 times as deep. I mean, just exactly the same way as...
Yeah.
If you're counting backwards, you ever try that on that? Does that count backwards? You're done?
Yeah, I've done that, but I don't remember, I don't know if I had good results with it or not. I honestly don't know. I know I've used that in teaching a lot of things. For instance, a lot of times when I've given a suggestion, say on these skin rashes or something like that, that as I count backwards with each number, this effect will be doubled, and that works pretty well.
Any other questions now as we go around? Yes, Dr.
Yes, I have a question. It's come up here 2 or 3 times today, and that is when you give post-hypnotic suggestion for sleep. I remember last time you gave post-hypnotic suggestion for sleep for a patient when it was up, and it looked like the respiration wasn't going to slow down. I noticed you waited and waited and waited, but and it wasn't slowing down. I heard Dr. Millikan make the remark, something about it'll have to be compounded.
Yeah.
How would you
I just tell them no. I know they're not asleep. I know they reverted to hypnosis. If you, here's what sometimes happens, doctor. You get your fore and aft amnesia, and then you give them a suggestion for the natural sleep, and they'll close their eyes. They'll take that much of a suggestion, but you can see from the respirations that there's no sleep there. Well, you still know that they're suggestible, that they're still in the hypnotic state. So I compound it right then and there. I say the next time you won't remember what suggestion I gave you, but that suggestion will be 10 times more effective and will work on you 10 times stronger than it worked on you so far.
Wake them up again?
And then I said, now open your eyes. And then I'll take a puff on a cigarette or whatever the cue happens to be, and boom, they're very deep then. And then you'll find that the respirations almost immediately go down to where you can attach the hypnosis to the sleep. And when you attach the hypnosis to the sleep, you've got something very, very beautiful. Weren't you delighted when you finally got that state, huh? It's a thrilling thing. It's a thrilling thing for a doctor to work with. Now, let's ask for any more questions, and if we don't have any more questions, let's proceed with the second half of this meeting today. Any other questions from anybody? Have we pretty well covered everything that you would like to have covered so that we know just about what it is that you want to see again today? All right. Yes, Dr. Milton.
Something else clear out of this type of work. Could you mention a little bit about this yoga?
I don't know anything about it, Doctor. I don't know enough about it to even talk about it.
And I've been asked about it several times.
I have too, and I think it's just a deep grade of autosuggestion is what it is. I'm sure it is as far as that goes. I think it's conditioned reflex. The man who holds a 200-pound weight from his eyeball, I don't get it. You know what I mean? I don't quite understand that. I can't understand what it's for, and the man who lays on a bed of spikes and thinks that he's going to get nearer heaven by giving himself earthly suffering. That's beyond my knowledge to comprehend how they think. And because I don't comprehend it, or maybe it's because I reject such thinking, that I don't understand it. Let me put it that way. I think I just don't understand it because I am loath to understand it.
That is just simply a religious ritual.
More than that, Doctor.
Used among the Indians, that is, people of India. I know about that.
I know that. I've met these men who can sleep on nails and stuff like that. But, boy, when you see the holes that they've got in their back and so on, from laying on those things for about 15, 20 minutes, And I don't know, that's self-torture, that's masochism, and I can't see it.
They've got to go through the torture.
That's right, they must. But I don't want to comment on it because any more than that. Now, friends, the purpose of our meeting today, that is what we try to assign as our reason for doing what we're doing now, is to let doctors see how stage hypnosis and medical hypnosis both stem from the same roots, and that the knowledge of the stage operator is oftentimes the knowledge that the doctor has, but it's used in a different way to get a different effect. Now, this is a scientific course, and we do not at any point do anything to make a person feel that they're going to be subjected to some of the nonsense that occurs in stage entertainment. I've got to stay away from everything but nice things when I work with hypnosis. Do I know how to give silly suggestions? Yes, as well as anybody, I guess. But do I give them at these meetings? No. Therefore, when we ask for people to work with today, you may rest assured that everybody who comes up here is going to like their experience and remember it as something very beautiful if we succeed at all. So, I think some of you have brought some people to work with. If you would come up here now and take these seats, we'll go ahead and show you what we plan on doing. So, come on, anyone who wants to come up Pratt. Sit down and make yourself comfortable. Now, surely more than that, you want to know what stage hypnosis is like, and if you would like to know, come on up. Friends, the stage operator works with the same respect factor, or call it what you will, the same prestige factor that the doctor works with. For example, when you first hear the stage operator is coming to town and that you're going to be able to see him, there are two groups of people. First is the group that says, gee, I'd like to know what he's going to do. I'd like to see the demonstration. But even those people respect the knowledge of the stage operator. Now, that represents the doctor's public, just like it represents the stage operator's public. Everyone respects the knowledge of the doctor. Everyone respects the knowledge of the stage operator. They may not respect the stage operator, but they respect his knowledge. And the same is true of your public. They may not like you as a person, but they do respect your knowledge. Now there's another group of people amongst those who hear that the stage operator's coming to town. Those are the people who say, gee, I wish he'd do that to me. I'd like to know what hypnosis is all about, and everything else. And he's the one who can do it. These are the ones who represent your patients. Well, you must realize that there is no patient who ever comes to any doctor who doesn't believe that for him, that doctor is the best available doctor in the world. If he knew of another available doctor that he thought could do more for him, he would go to that doctor. The very fact that that patient comes to you says that to him, you represent the greatest doctor on earth. To these people who come up for the stage operator, he represents the man with the knowledge, the man who is going to help them. Now, the prestige is quite similar, and if you see it from the viewpoint that I see it, that the same factors are always at work, both with the stage operator and in the doctor's office. The people who respect the knowledge, the people who want to partake of that knowledge. The people who want to partake of that knowledge are your patients. The people who just respect that knowledge, they are your public. They are the ones who see that doctor before or after your name and respect the knowledge which you possess. I work with a great prestige factor. A great prestige factor, and I know that. That prestige factor has caused me to be able to do things that a lot of people have tried to emulate, and some have been quite successful and some haven't. But nevertheless, the prestige factor is there. You take these two little children here. Ask either one of them, and they're pretty big children, incidentally, and not too little. But these two children here, ask them. Oh, they want to know what it feels like to be hypnotized. Isn't that right? Huh? Sure. And they know that if anybody can let them see, I can let them see. How'd you do in your studies?
Just fine.
You did?
Just fine. Real good. One interesting thing that I wanted to tell you, we had a math exam, trigonometry, that was so stiff that approximately 50% of the class flunked it. I got a B+ on it. And I found myself chuckling through the whole exam on things that we just covered, problem 8 types. One extremely interesting thing, I relaxed myself while I was taking an English exam, in which we had to write a 1,000-word essay. My mind was wandering. I knew the subject, and because my mind was wandering and I couldn't get down on paper what I wanted to, I just pushed myself back away from my desk and relaxed. Well, one of the proctors in the exam had thought I had fainted and came rushing up and was shaking me. What was the matter? And I woke myself and proceeded right from there and didn't have any trouble at all whatsoever.
Yeah.
I actually look forward now to taking the exam. Just to heck with the teacher. I want to get down on paper what I know.
Yeah. See what I mean? That's when you get to the cause of the thing and remove the cause. And now, that's the usual result that we hope occurs, and occasionally we fail. If I hadn't hit the exact thing with him, he wouldn't have that success. But we hit the exact thing, and hitting the exact thing, see, I missed with you, Doc. I didn't miss with him. But that doesn't mean that I couldn't have missed with him. Just like I could have missed with him and succeeded with you. I want you to know that even the so-called authority in this field is not perfect. We can make mistakes. Gee whiz, I would have gambled $1,000 to a nickel that we had hit the cause and covered it completely. But someplace in there we didn't cover it completely, or those symptoms wouldn't be there now. Now, first you have seen that the prestige factor of the doctor and the stage operator are quite similar. You both work on the same thing. Now, the second thing you must know is that the stage operator has to do something entirely different than the doctor has to do in his office. The stage operator must put on a show. The doctor doesn't have to put on a show. The stage operator must make the subject seem mysterious, dramatic. That's why you see pictures of hypnotists with flashing lights from their eyes and so on. And how you see Polgar allowing himself to be photographed with those weasel eyes of his distended to all out of proportion to his face. And yet he allows the picture to be taken because he wants to give the impression that hypnosis is something mysterious, something difficult, and only he possesses the knowledge. Well, that's nonsense. The doctor doesn't have to work with this factor. The stage operator has to put on a show, so he's got to make himself seem dramatic. Therefore, the average stage operator, when you see him make his appearance before a group, will wear dark clothes, will allow his beard to grow, and if he hasn't got a beard, will either manufacture one or else come out with makeup that is very dark and sallow so that he has a very sallow complexion. If he's playing a theater date, and will even put a turban on his head, as though that's going to help some. If not a turban, he'll put some other covering on his head that makes him look like, one of these Orientals who's going to do a fantastic job. This is all for show. It has nothing to do with fact. The fact of piercing eyes, gee, I've worked with hypnosis for over half a century, and I don't find that the eyes have anything whatsoever to do with hypnosis. So these are some of the things that you must know when you see the stage operator come out. He's got to put on a show and make it seem dramatic. Now, another thing where the stage technique varies from the doctor's technique is that the doctor doesn't find the techniques of the stage operator valuable. Why doesn't he find them valuable? Because the stage operator must work with a group such as this. I've got to hypnotize a lot of people at once. But if you want hypnosis for Mrs. Jones, you've got to direct it that way. The stage operator directs his hypnosis this way. He wants to cover everybody. You just want to cover that one person who needs it for a specific purpose. Now that he comes out, after this introduction in which he is pronounced the world's greatest something or other, now he comes out and he gives a pseudo-scientific lecture on hypnosis. I say pseudo-scientific because the average stage operator doesn't even know why he does certain things. They are done, if you have had the kind of teaching I have had. Everything that I ever did in hypnosis was explained to me as to why I should do it, and the reason for doing it. And that's why in teaching you, I have tried to show you each little thing and why it is done. For example, after he has made his pseudo-scientific lecture in which he makes hypnosis this glamorous, mysterious subject, he then says that now he is going to test for suggestibility, to test whether or not they can be hypnotized. This is about as valid as a spoiled egg, because it is strictly hooey from beginning to end. Now, watch how doctors were victimized by the dramatization of the stage operator. Would you stand up, please, Mrs. Wax? Would you, with your back toward me? Now, this is testing for suggestibility, according to the stage operator. Now, just imagine that you're falling backwards, and I'll be right here to catch you. Let yourself come back. Just let yourself come back. That's right. Oh, and then she comes back, and I catch her. I make a big motion. All right, you may sit down. Does that prove a God-fearing thing? No. But the stage operator, by his looks, oh boy, she can fall backward. Why, he makes it seem like this is really a test for suggestibility. But gentlemen, does it fulfill the requirements? Not at all. When I asked her to fall back, I did no more than when I said, Mrs. Waxman, thank you, won't you be seated, or whatever I said, or you can sit down, or something like that. It was the same type of suggestion. Let's do it again, so that you can see it. Would you mind again? Now watch. This is the thing that Erickson and all the others took from the stage operator in perfect nonsense, believing that they were right. Because they saw the stage operator do it. Well, was it necessary? The stage operator is putting on a show. Of course it isn't necessary. But, now when I say fall back, is this a hypnotic suggestion? Fall back. Now just let yourself fall back. All right, I catch you. Thank you. Now, is that a hypnotic suggestion? No, it doesn't. It's no more of a suggestion than won't you be seated. Why is it no more? Because it does not bypass the critical factor.
Doesn't it show suggestibility and cooperation?
Not the slightest. Not the slightest.
Then why did she fall back when you tell her?
Why did she fall back when I asked her to? I just told her to do it, that's all. That's all.
I mean, I thought that
it's a show. It's a show.